Welcome today to this talk with Dr. Martine Jus. Jus, is that the correct way to pronounce your name?
In German, yes, and in English you can say Jus.
Martine Jus. So Martine is the director of the SHI Homeopathic College in Switzerland, and a very experienced homeopath, and has, along with her recently departed husband, developed the school, and she's going to talk to us all about how good it is in Switzerland, how well it's working, how well the school is going, how excellent the numbers of enrollees. She was just telling me moments ago about the fact that the school attendance is absolutely full, and I'm so excited to hear about this wonderful example in Europe and the opportunities for this to be expanded out, for the example to be taken into other places. So welcome, Martine, and please introduce yourself, and I'll be sure to ask you questions as we go.
Thank you. Hello, Nils. Thank you for having me there. So my name is Martine Jus. I'm a trained veterinarian, and I started with homeopathy already in my studies. Then I met my husband, Dr. Mohindas Singh Jus, and I learned homeopathy from him. And together with him, we built the SHI Homeopathic Center, basically. And out in this center, there is, of course, a college, which is the heart of the center. But we started to build this in the early 90s. And unfortunately, he is, as you said, he died last year. And so I took the lead, and I'm doing this further. And the center is the concept that basically it was the vision of Dr. Jus, of my husband, and I found this vision so great that I decided to make it also my vision and to work to give my life for that, because I strongly believe that every human needs to find his mission in life. And when you found your mission, whatever your mission may be, your mission may be to have a nice garden. This is also a great mission. Doesn't need to be always so great. But whatever you do in life, you have to do it with passion and with love and with enthusiasm. So this vision that he had was to give homeopathy a house in Switzerland. And that from this mother house, that we have, how to explain this, that we have so good vibes coming out, but that homeopathy has a house. And in this house, it should be a center for homeopathy where everything around homeopathy is there. So we have the homeopathy college. We have also a clinic with, now we are 8 homeopaths working there, 24 hours emergency service, and it's a big center. We have patients coming from all Europe to us, and of course all parts of Switzerland. So this is what we build up all together. And because my husband was such a gifted and an incredible homeopath, it's absolutely, it was such a privilege to do this with him and to learn, of course, from such a master. This was such a privilege. And we have also the clinic, the college, and then we have a homeopathic pharmacy. We have also a homeopathic publishing house, and we have, together with this, we have also a beautiful homeopathic garden with a lot of plants, and trees that we are using. We are not using, this is a show garden, but this is a garden to show the public and our students, from where our medicine comes from, the one we can cultivate, plus the one which come from plants, which is around, in the homeopathy, around 60% of our medicine, 60-70, are coming from plants. So this is if you want like a center like this where everything, all the vibes, it's all homeopathy. And this was the concept, and this is what we did together the last 30 years, and what I'm now continuing with my team.
I wonder, Martine, if you could just explain how an emergency centre operates in a homeopathic clinic. Do you have like overnight stay available for visitors?
No, we don't have overnight stay. This is a legal problem that we are having in Switzerland, because in Switzerland we have, like everywhere in the world, you have the medical, the medical homeopath, and if you want the allopath practicing homeopathy, and you have the professional homeopath. No? Mm-hmm. And we are in Switzerland under professional homeopath. We are recognized because this is the work of our 30 last years. Homeopathy is recognized in Switzerland, but of course, such things like, stay overnight and things like this, we don't have. But we have a 24-hour service where people can call, they can come, and we treat them, in the clinic. Mm-hmm. And this is working very well. This is extremely important because you see, homeopathy comes basically when Hahnemann started this. Where were his first successes? In acute cases, and then later on in epidemics. These are the first things. No? If you think of all the success of homeopathy. So this is the strength of homeopathy, is in acute cases. And we had the great privilege to work together, to learn from Dr. Jus, from my husband, who himself was a master in acute cases. He worked in hospital in India. He had so much experience.
Okay.
So if you want to convince somebody, to show somebody how homeopathy works, nothing is better than acute cases.
Yep.
You are vomiting, you have diarrhea, you are out of your really very bad, and then somebody gives you arsenicum, and 15 minutes later you are hungry. This is you think, wow, this is something. This is something. So that's why we decide this is very important, and to all homeopaths worldwide, the patients need a 24 hours system, reachability and system, because this is the main thing. We can't tell the mothers, the earache of your child came after 6.
Yeah.
Then I'm not there.
So if I was to draw a parallel then, the clinic that you're running is like, in Australia, it would be like an allopathic general practice. Where
it's an OPD, it's an OPD if you want. It's absolutely,
yeah,
yes.
Okay. Yeah. So, that's absolutely, and, marvelous what you're doing, absolutely marvelous. And I personally love the idea that you're actually saying, let's get into the sharp point of all of this and actually deal with the actual acute presentations. And I know that like homeopaths here in Australia, they would deal with an acute case because obviously when somebody turns up, but normally it's all booked weeks in advance. If you're going to go in to see the homeopath, and it's this big long whole and involved type of a process. So what you're talking about is, I've got a problem. I'm going to rock up to the clinic and it's emergency.
People walk in. They can walk in and say, "Oh, I'm having a problem." But I have to tell you, when my husband came to Switzerland, it was in '85, and he noticed that acute cases with homeopathy, this was very rare. He was getting cases with such, only chronic cases and all this. And it was the same situation. He was not the only one, but I'm talking about him, he had to build up this. He had to show the people. It was hard work till the people and the mothers and everybody had trust into it and say, "Oh, it works." So now when I have a bladder infection, when I have a cough, when I have whatever, I go first to SHI. This didn't come to us like this. This has to be, we have a lot of talking to the patients, of explaining and showing. You have to give the right medicine. You have to have success.
Okay.
And it is also a fact, and here I come to the college. If you want to have success, not only in chronic disease, but also in acute disease, you have to have a lot of study. You can't have an acute disease. If I take the example of this vomiting, diarrhea, and cramps in the tummy, okay, I can't make a case taking of 45 minutes with you and then tell you, okay, first I have to repertorize, and please, in about 2 hours, I will give you the medicine. It doesn't go. You can hardly talk. I have to decide this on the, really very fast. So materia medica has to be here, not in the books, here. And in order to do this, you have to have very sound study, very sound study. So this is what our plan and our vision, and we are already there, but we can always get better. It is that our students have such a mastery. Tough studies the level should be high, and that our students have such a mastery that when they are with the patient, they are not fighting with books, but they are understanding the patient. Yeah. This is the method, that we learned from my husband, is a method based a lot on very sound knowledge of materia medica and of the rest of homeopathy.
Mm-hmm. So obviously, Martine, in your case and your husband's case, you're both doctors. Like you've had an extremely extensive medical background coming into homeopathy and the approach. So you got a lot of resources to draw upon yourself. Like I'm talking about you.
My husband had the huge chance to study in India. So he didn't have to go through allopathy. I don't know if you're familiar with the system in India, but in India, homeopathy is taught on university level in universities, and you are taught a very high level of medicine, but it is already embedded in the homeopathic faculty. So it's another system. So this was his way. And my way was a little bit different, as I said. But you're right. We had it is important to have a very sound knowledge of medicine also. Our students, in our curriculum, they come 4 years to the full-time 4 years. And out of this, almost half of the subject are medical subjects. Yes. It's very important. You can't just have a vague knowledge. This is not enough. Because if you have a vague knowledge of medicine, then you can't treat the acute cases, you can't treat difficult cases. We had in the clinic, in 2 weeks ago, a case of encephalitis. You can't treat this if you are not sure of what you're doing medically also, not only homeopathic. Yeah. So this is.
Yeah, no, I get it. So, this training that you're providing, obviously, given that you have the clinic and you're dealing with emergency cases, your an emphasis is actually on, as you say, the speed of being able to carry out a diagnosis. Well, use that word. I know it's not a totally appropriate word, but to be able to really determine what's going on very, very quickly. So in the school, do you have particular speciality in that, in those processes, or how does that work?
Yeah, I mean, what we set up, this was also, again, a very, at that time, a revolutionary idea of my husband, is that we started we show live patients to the students from the first semester. So you have to imagine, if you're students in our school, you see a patient and you're going to see him for 4 years. He's going to come again till his problem is okay. Because this is often there that we are getting problem. It's not to give the first medicine. but it's how to deal with the rest later. When to repeat, when to change. These are big subjects in homeopathy. So we show them a lot of patients. Then we have a lot of practical work, ambulatory, a place, you know, where in the clinic reserved, where the students are making the case taking themselves. Then they have a lot of practical training. It's very important. This is definitely a big part, no? Because, you know, we have, of course, a lot of acute cases, but still, the bigger part of the work are the chronic cases. It is, you know. But also in the chronic cases, not that you understand me wrong, it is not that after 10 minutes we send the patient away, but my husband always said, look, after 15 minutes, longest that you're talking with the patient, you should know where you are. You should have understood something. And then the medicine gets clear. Maybe you need, when you are a beginner, longer, maybe not, maybe later on ones need shorter time. And then you can talk to the patient. You can talk about life. You can talk about what he should change in his life, you know? You can get to the core of the problem, why he has a migraine, why he has sleep disorders, and you can help him to take responsibility for his or her own health. Mm-hmm. But you're not fighting with symptoms, you are just understanding the patient. It's a different approach.
Yeah, okay. So that second approach you're talking about is the psychosomatic, you know, more psychosomatic type of issues, or is it more general?
Not only general. You know, homeopathy sees the reason, the cause of the disease, never on the physical level. It's always on the dynamic level. This is a very complex theme, but we strongly believe that before we get symptoms, the disease has already started somewhere. No? It is not only that it can be an emotional reason. Sometimes it is an emotional reason. If we take a migraine case, maybe there are some emotions which are blocked, maybe some hurts, maybe something. This is possible. No? Can go up to the childhood, or even before sometimes. No, it can go up to the parents. Sometimes we are born with a tendency. You know, if a child is born with a tendency since day one, he's born with neurodermatitis, you know, the problem has to be looked into the family history of this child.
Sure.
But we should never treat the skin. We have to treat the one who has a skin.
Yeah.
So this is what I mean, you know, by going through this with the patient, making him understand why he is sick is very important, because only if the person understands, I have hay fever, maybe because I am not dealing correctly with my emotions. I'm not showing my emotions. I can't cry. I can't shout. I'm always very composed, you know? And maybe that's why this plays a role into my hay fever. So if after the homeopathic medicine, I'm angry, or I have tears, I'm sad, okay, my homeopath told me could happen. It's good for me. And then, like a wonder, the hay fever goes.
Yeah.
You know, all these kind of things, this is a daily bread for all homeopaths worldwide. But if you talk to your patients, if you help them to understand themselves with the very little knowledge that we have, because we are only a small part of such a huge thing, but with whatever we learn from our teachers, and with whatever we learn from Hahnemann, we help them the best we can. And this is often very fantastic. You know, I still get goosebumps with the patients when the patients think, that's it, and now I can do something against it.
Okay. That sounds perfect. So like in an emergency patient coming in, obviously the the homeopath has to be able to act very quickly and on limited data. And then, as you're going on, and even in the conversation later, perhaps there's this opportunity for presenting to the patient the aha moment. So
Yes.
you're giving them the opportunity for that aha.
In acute cases, this is very quick. It depends also how acute it is, how bad the state is, of course. No, but I tell you a case that we had, maybe just to understand that, we had a case last week of of a young girl, 15 years old. She came into the clinic and she was like this. She was like this. And crying and having so much pain and what is the matter? Oh, I don't know, my kidneys and whatever. I said, no, it's not the kidneys. I looked into her eyes and I said, what happened? Nothing. I said, is it better warmth or not? Or not? She said, yes, okay. I said, what happened yesterday? And then she looked at me, the eyes became even more full of tears. She told, my parents had a fight. Okay, I went, I got the medicine, I gave her colosynthesis, and then I gave her into her mouth, and then I could see, and then I said, what happened? I could see she was getting, better. She was not like this anymore. She started to a bit like this, and I asked her, what happened yesterday? Then I counseled her how to go with when the parents have a fight. And I explained her that the cramps she had were because she swallowed her emotion and she went in the middle of this fight, So she understood that she can do something for her future, otherwise she will get again cramps the next time, no? And we can help the patients like this, but this is done in 5 minutes. You don't need to talk, I don't know how long with the patient, Homeopathy is such a blessing. You look into the eyes of these patients and you see, okay, the patient is like this and obviously cramps. And then you make 1, 2, 3, 4, you connect things and oh, she must have had some emotional problems. It's wonderful. This is a fascinating therapy.
Yeah. But one of the, as I mentioned to you before, I'm not a homeopath myself, but I've received a lot of homeopathy. And one of the fascinating things is that when I observe homeopaths in operation, is that they have unbelievable breadth of knowledge. So it's an incredible broad knowledge. Yes. But at the same time, they're extraordinarily intuitive. So, there is this intuitive process which is sort of mapped somehow onto this breadth of knowledge. And what you're talking about there, that speed of diagnosis and being able to look into the soul of the person, looking into their eyes or whatever it is, that's a deeply intuitive mixture, isn't it? Or am I seeing that the wrong way?
No. There are very many different approaches in homeopathy. I'm not saying that one is better than the others, than the other. I can talk about the approach that I learned and that I practice, And this is definitely an approach which is, for me, fascinating. It came it came from my husband. I learned it from him, but he learned it from his teacher, which was Dr. B.K. Bose, a very famous Indian homeopath. And Bose was himself a student of Kent. So who is, I think, for everybody. So it is Kent, Bose, Jus. This is like a Kentian line. And Bose used to say that Kent was not working with a repertory. He made this for his students. He was working very differently. He was working with mental repertorization. His knowledge was so huge. And Bose, having learned from him, became a master in this mental repertorization, And he was a master of miasms and of very quick prescribing, but not prescribing, only on symptoms, really understanding what is the problem of the patient. And my husband continued to refine all this method. and to bring it so that we can apply it in acute cases, in chronic cases. We work a lot also with paraplegic patients. And this is a tough, something very tough for homeopaths, because we need symptoms. And we treat also a lot of urinary infection. They have a lot of problems with recurrent urinary infection. Yeah, if you don't have any symptoms, it is not so easy because they don't feel. And with the method that we are having, with a lot of observing, a lot of emphasis on not only on the psychic symptoms, but also on the general symptoms, and the miasm, we can prescribe very successfully. So this is this method. But I know there are many different approaches. Some homeopaths talk maybe for 2 hours with the patients. Then they go through a very lengthy process of analysis before they give the medicine. What should not be said to the patient is that homeopathy takes time. It is not a general, it is not wrong, but it is not right in all cases. No. If I have an acute case, it has to be instant. If I have a chronic case where the patient has problems since 30 years, it is clear that it's not going to be gone in 5 minutes. This should be clear. But something should happen. It is not so that the healing process should be visible. So sometimes I have the feeling that some homeopaths are hiding themselves behind, it can take some time, but we have to know. The patient has to be into a process. I had yesterday a case. It's a lady with neurological problems. She has, some ataxia and some problem. And the doctors are not finding, all the specialists, they are not finding what she has. She came to me and her first thing was to say, I have enough of life. This is a bigger problem, no? Than not being, to be unsure on the legs. I made the case taking, gave her the medicine. It was 2 months back. Yesterday she was here, and I said, "So, how are you doing?" "I'm so much better." I said, "What is better?" "Oh, I feel like doing things, and I feel like life is nice, and I could have a nice fight with my partner, and since then it's much better." And then I talked to her for half an hour about this, didn't talk one word about the legs. At the end, very much at the end, I said, "So how is the strength in the legs?" She said, "Oh, this is also getting better." This is the proper way. This is the proper way of dealing with the patient and of healing. This is the healing process. I don't know how much we can heal this neurological problem. I don't know. But it becomes not so important for the patient when first we have to have this will to live, this will to be happy, this will to go forward. And then the body can be healed as much as it's possible. The boss there, up there, he decides. We can just try.
Absolutely. So I wonder if you could just talk a little bit more about your plans for the school. So what is your...
So we have 2 main programs, one for animal homeopathy and one for homeopathy in general. These are the 2 main programs. The animal homeopathy program goes 3 years, the other program goes 4 years. And we have different modules, people can make different modules, and so that we are flexible. This is very important. And we have students who come with zero knowledge, they were teachers, they were whatever they were, no medical knowledge, nothing. And we have also students who bring medical knowledge. We have nurses, we have also doctors coming and studying homeopathy, and depending how much of medical knowledge they bring, they have to make the whole course or they have to make just part of it, obviously. No? So this is the concept. And the concept is similar for both programs with a lot of practical training. And what we want, the aim in both are that in both programs are that the students can really open a clinic when they are finished. They can open a clinic, they can open their own praxis, and they are sure enough. They've seen enough patients. They are sure enough to do that. Of course, we have to learn all lifelong. This is clear. This is just the beginning. And I can tell you, like in many other subjects, the more you learn, the more experience you have in homeopathy, you know only one thing, that you know very less. I have the feeling, the more I progress, the more I think, oh my God, such a vast ocean still to learn. This is, But that's why we have a third program, which is a postgraduate program. A part of it is online, and a part of it is our seminars that we have in our house, or we make also seminars in Germany when it's sometimes, but mostly it is in our center.
Okay.
And we have a fourth program because it's very important. And if you want to know the success, why we have success with our center in Switzerland, I am very sure that this is a big part. We have a big program for lay people, where it's just information. We are not, it's just information. We are not making out of them homeopaths, of course not, but we are explaining them. I have a speech next week on homeopathy in puberty time.
Okay.
The aim is not that the patient, that the mothers and fathers who are coming to this course, that they prescribe themselves, but that they understand more so that they understand what can homeopathy do, how is the approach, and why is it important to come. With a young daughter or young son. So this is a very important part, just to explain the general public what is homeopathy, because it is so vast. It is not just treating with natural medicine. This is not just to give some globules, sweet globules, and this is such a potent, such a strong medicine. And you have to understand that. You have to show them this. That's also why my husband wrote this book, Journey of a Disease. This is very important. Just by we are not half mediums, but look, sometimes to the patients it sounds like this, but it's just sound knowledge. A mother comes with a child, very thin child, very thin child, little bit like this, very much moving type, and he comes because recurrent ear infection. If my first question is, who had tuberculosis in the family? My father? How do you know that? I don't see in the future, don't worry. I'm absolutely down to earth person. But this is the teaching of Hahnemann. This is the teaching of both, and of Kent and of my husband. So, and when you show the patients all this, and when you show them that how important it is not to suppress symptom, not to treat the skin as a skin, but as a part of a bigger thing. If the skin is itching, there is a reason for it. You have to go to this reason. You should not treat the skin. Otherwise, it's not only just a concept, it is truth. Otherwise, if you treat the skin, for example, then the child or whoever it is, whoever the patient is, will have other problems. Okay, my skin is good. Oh, now I can't sleep. Very great. Oh, my skin is very beautiful. This is fantastic. But I'm depressed. Oh, my skin is great. Now I have asthma. And this is our daily bread in the homeopathic day-to-day practice, you know, to explain patients that symptoms disappearing is not the same as healing, you know. Healing is much more complicated than just the disappearing of the symptoms. So that's why we always have to go behind the symptoms, understand why the patient is sick, and then we can help him to find his personal healing process.
Well, look, you know, what you're talking about there is the gulf between homeopathy and allopathy, really.
Yeah.
You know, that suppression of symptoms is such a profound aspect of why people go to the doctor. They just want those symptoms gone. They don't care anything about anything underlying. So, you know, all strength to your arm as far as I'm concerned. Tell me how, you know, running forward with the school, do you have plans to expand it in any way? What are your plans for the future?
What we are surely going to now expand in the school, you know, it's all the online part of it. This is going to be, because obviously due to the situation now, this takes we have to plan a bit differently. We could, I think everybody or many of us who had some, I was first of the one, you know, to be a little bit like this. I said, no, I don't want to go this line. But I do want, we had to because of Corona. So now we see also the opportunities of this. So this is one part that we are doing. And otherwise with the college, you know, we just want every batch should get better than the other one. And my dream is that we can really place our students in hospital, that they are accepted to work in hospitals. You know, this is the next step. And for this is a lot of work still to do, because only when we have in each hospital of Switzerland, when we have a homeopath working there, we have a chance, you know. It's a lot of work. Ideally, we would have homeopathic hospitals from A to Z. This would be ideal. But sometimes when this project seems to be very difficult, you have to find another way.
Okay.
And this is a way, you know, working together with the hospitals and with allopathic hospitals. And many are open. It is not this, that there is no openness. No, I know many allopaths who are very, very well aware of their strengths and of the weakness of their system also. So it's not this, but it is again a big project.
Yeah. Well, it's a massive project to go from, you know, a call-in or a drop-in centre to actually having a hospital. I understand that's a massive shift. And it's a wonderful idea to actually go and, you know, blend in, you know, with the allopathic hospital. I think that's terrific.
Yeah, well, you know, our students are already making practical training in allopathic hospital. I mean, allopathic practical training, and this to be intensified. You know, this is the first step, and then go further into having homeopaths there. We are having an example of how it can work, because we opened. We opened a small department, a homeopathic department in the paraplegic center we have in Switzerland. We have a wonderful paraplegic center, very known, you know, and very high standard. And we work together with them. We have some research project with them, and they are very open to homeopathy. And we have there, we go there, you know, regularly and treat the patient of the hospital there, and we work together. And such a project should be, this is the next step, you know, such a project to have similar project in other institutions, and then to send our students, and then, you know, slowly.
Okay. Is there an opportunity, like, you know, what I'm hearing is just a breath of fresh air from, you know, what I'm actually seeing in other places. And is there an opportunity for your college to open up branches in other countries? Would there be an opportunity to do that?
Look, I don't know how it's going to be in future, but I don't see it now. I think strongly that we have to grow from the center, like the center is the mother house, and it is in Switzerland. But I think that we will go more and more, doing like more courses here and there. Okay. But I don't think, because you need really, if we want to have the success we had in Switzerland, you have to have really such very very experienced homeopaths to do this, and to find such experienced homeopaths who wants to go to in foreign countries is not easy. It's just the logistic, the logistic.
Yeah, no, fair enough. That makes total sense. So the mother place is there in Switzerland. I appreciate that, and for people watching this interview, then make plans to go and study in Switzerland if you're interested to become one of these very highly successful professionals. So that makes complete sense to me.
Yeah. Because we had a very hard work when my husband came in Switzerland. The word homeopath was never used. You have to think about it. It was in the 80s. They were saying homeopathic doctor or naturopath. No? So we had the two professions. We had no profession as professional homeopath known in Switzerland. And this is his work, which I had the privilege to help him through this, And that's why now in Switzerland, we are saying they are homeopaths. This is everybody used this, but this was also a lot of work. And we have this situation in Switzerland because the level of education is very high. And in this also, I think that SHI plays an important role of always, setting up the level very high. And we have a national recognition for homeopathy. It's very important, and a good one, not one who is worth nothing. A good one. And these are very important things. We had a lot of political work in the last years, and so that homeopathy has some kinds of legal protection.
Yeah. So tell me, Martine, has the the standard keeping, is that integrated with the government authorities, or is it all done by the college?
It is a little bit. Also, we have in our state, we have regular checks from the authorities. We are under the authorities, of course. They make inspection and all this. Absolutely. Plus, we have another system but we are the only one in Switzerland like this. The only college who are under, because we are the only one having this type of education on that level. There is another type of education which also leads to a national recognition, and this is under the association. The association, it is like this in Switzerland. The central authorities are working together with the association, but the association come to you and make the inspection. It's actually also a good system. So we have both possibilities in Switzerland. And for us, we are under the local authorities and controlled also by the association, by the professional homeopathic association.
Okay, very, very good. Okay, so there clearly would be a strong linkage between the professional association and what you're doing. Do you have them sitting on your board? Like, do you have an academic board or something like that?
Yeah, but we don't have them sitting in our board, but we have boards in the central associations. They have boards, and the college is we are involved in this. Okay. So there is a good work together.
Yeah, no, that's terrific. Okay, very, very good.
So maybe this is the reason why homeopathy is actually in a good position in Switzerland. I will tell you frankly, it is not all college will tell you that their classes are full. We are blessed. We are blessed to have such a success. It is sometimes I think my husband, the soul of my husband, the spirit of my husband is also giving us such an energy, you know, that this is yeah, we have to do it, and we have success, and it shows that many people are interested in homeopathy. Many.
Absolutely.
I don't agree, you know, when people say, "Oh well, we don't, nobody's interested in learning homeopathy." This is not true. But you have to offer them something. You have to believe in it, and you have to show them the success.
Well, it was clearly been an uphill battle for you both, you know, to actually get to where you are here at the moment. But it's had tremendous passion behind it, and you know, the sense of purpose. And you know, if I think about 2020 and people that I would talk to, that it's common for people to suffer from a lack of purpose. They don't feel as though they have, you know, particular purpose in their lives, and you know, that to see somebody like yourself and clearly your husband, you know, with such strong purpose and strong will to, you know, succeed with your dreams. It's absolutely marvelous. I do have a further question, and that is, do you have like a research facility into the development of new remedies?
Yes, we have a trust in our house, in our center, which is called the Dr. B.K. Bose Trust. It was set up in the name of the teacher of my husband, Dr. Bose. And under this, we are making research. We have research programs. We are currently not making provings, what you're saying, looking for, you know, making research on drugs. But we proved 5 drugs till now. And 5 drugs which are very, very successful, and we profit a lot from it in our clinic, and many homeopaths could also understand better these drugs. And then because we are not a huge trust, so we have to choose, you know, depending what we want to do. Then we had a lot of so-called many clinical projects, like the project I said about urinary disease, recurrent urinary disease in paraplegic patients. And so this is under the trust. This is important, you know. I'm not so sure if we are planning for the next one. I don't think that we are going to go for approving of new drugs.
Okay.
I think that we have in homeopathy a lot of insufficiently or even unproved drugs. We have many drugs, you know, which we have very limited knowledge about these drugs. And first we should finish this work, and then we can go to other drugs. You know? Yeah. It is, my God, in 1,000 years we will not, because homeopathy it comes from nature's womb. So you can't have all of it. It's just a small part, and every homeopath worldwide, there are many great teams everywhere doing research programs, you know, and working with a lot of passion and a small contribution. Every of us can do a small contribution to understand a little bit better this huge present that we have with nature. Everything is there. We just need to understand it.
Okay. So look, if I understand you correctly, what you're saying is that the trust is identifying specializations, like, for example, these urinary issues with paraplegic patients. And, you know, it's kind of like, it is a clinical approach, so that you're actually developing clinical approaches surrounding.
Yes, we have both. We have this, if you want, this basic research with the provings, no? Yeah. because it is not finished. When you have made the proving, afterwards you need to have the clinically confirmed symptoms. It's a lengthy process.
Yeah.
And plus we have this clinical approach for different subjects. For example, also we had a project with, we are working with a clinic who is specialized in the cancer rehabilitation in cancer patients, and how can we help with homeopathy and, and these kind of things. It's very important also project for maybe not so much for the profession directly. We don't learn that much because we know it works, but to show the patients what is possible, to show also the other doctors what is possible to do with homeopathy. It's not about proving that homeopathy is working. This is not about this, but to show how can we work together.
Absolutely. Like I see that as being critical. Like what you're doing there with the trust, it's brilliant, because it's actually saying this is how we can go about it, and this is how we can contribute into what the allopathic doctors are doing and so on. So,
I strongly believe, Neil, that everything can succeed in a project like our, or like many other projects in other fields, if the intention is pure. The intention should never be our ego to prove we are better, we know better, homeopathy is the right way to go, or I don't know what. This is never about this. It is a very humble contribution to help our fellow humans and our fellow animals and our fellow plants and the whole planet. And we learn something from, we learn something, we have some knowledge, and with this little knowledge to make a contribution. If the intention is pure, if it is just in this, in this to serve actually the community, then I think then the results are also coming. If we lose our track and suddenly we want to have the biggest school, we want to be the best, we want to, and we want to go to international conference and be known, and then it is wrong. It is all wrong. Then nothing happens. Then, the energy channels are blocked. Then nothing happens. The blessings are gone and nothing goes. So this is very important, our intention, why we do something and how we do it. And stay humble and understand that, we make a very small contribution. But the trust, I do agree with you, the trust is very important in our whole program. It also has an important function in helping students, with, how do you call this in English now, with money, so lending money to the students or helping them, to realize their dream of becoming a homeopath. This is also a very important, important part, and also helping to have many activities to in the general public awareness. So these are many functions of the trust. One of them, very important, is the research.
Well, Martine, I wonder if you have any parting comments, anything you'd like to share with the viewers. And
I think, the more I'm allowed to work for this project and for homeopathy, and the more I do understand what my husband always tell me, always told me, this is a sentence of Kant: love homeopathy and it will love you back. And this is something which I would tell to everybody. Love whatever you do, it will love you back. It has to come. Everything grows in our universe. Everything grows from center to periphery. Each of us, we are our own center. We can make a lot of change, but we have to do it with love, and we have to believe in what we do and do it with passion, and the results come. If it is our love to our children, if it is the love to our plants, if it is the love to our job, it's all the same. It's all a part of nature, it's all a part of this wonderful world we are in. And homeopathy, being a blessing of nature, is a wonderful approach when if somebody wants to understand, why am I sick? What can I do? And if somebody wants to go behind the itch, understand why it is itching, or why is it paining, or why, you know. And homeopathy has a lot of answers to understand this why.
Well, Dr. Martine Jus, it's just been an absolute pleasure to hear you speak. It's inspiring, and I'm an old man, but I'm thinking of coming to Switzerland and studying.
You're more than welcome. You're more than welcome.
Well, thank you, and you know, Godspeed with your work. You know, like, this is such important work that you're doing, and as humble as you are, you know, please, you know, take the pat on the back, because you deserve it. So thank you.
Thank you so much. Thank you so much for having me here. And I wish you, Neil, and the whole team, you're doing such a great job. I wish you a lot of strength and God's blessing for your mission.
Well, thank you. Thank you.